There we go.
Good afternoon, viewers. And we were coming from the National COVID-19 Multi-Stakeholders Response Forum. We were launched on Saturday, March the 28th, and we've been meeting and reaching out to various stakeholders in our society to do what we believe is our moral duty to protect our citizens and to reduce the risk of transmission in our society and to protect and save lives. We're doing so because we believe that thus far, the efforts of the task force set up by the government have not addressed some of the major issues and challenges confronting our people at this time with the COVID-19. Yesterday, we submitted and released a statement to the public in which we're advocating for two campaigns. One, a stay-at-home self-isolation campaign for persons who are in non-essential services, and we will explain more about that. And we're advocating for everyone wear a mask once they leave their homes. We believe that these two interventions can reduce the risk of transmission and the level of transmission in our society. With limited resources at our disposal in our country and as a COVID forum ourselves, we believe that these two interventions can help in a major way to reduce the transmission in our society. COVID-19 is here, there's no doubt about it. And we as Guyanese are no different than any other people in the world. We are not immune to it, as is the case in all countries of the world. And therefore we have to take this pandemic seriously and from a national, comprehensive and inclusive manner. So I'd like to ask that Dr. Frank Anthony, who heads the Subcommittee on Health, give you a report on what we have been doing in the last few days since our formation.
Thank you very much, Gail. As you know, we have been quite busy over the last few days since we launched this committee. And the Health Subcommittee has been extremely busy. Over the last couple of days, we have been able to set up a coordinating health subcommittee consisting of a number of members from various medical profession and background. We also recognize that there are a number of persons who would like to get information about COVID-19, but are unable to get access online or to persons who can give them that. And we felt that as a community that we will be able to provide that advice. And so one of our initiatives have been to set up the Doctor Online 24 hours. So what that is really, it's a Facebook page, and anyone who have questions pertaining to COVID can come to that page, ask medical questions pertaining to COVID-19, and you will have a medical professional who will respond to you. So far, that platform has been working quite well, and we have been getting literally hundreds of requests coming in from the general public trying to answer their questions pertaining to COVID-19. In addition to this, we also recognize that there are a number of health professionals who themselves would like to get more information pertaining to the best practices and the latest development relating to COVID-19. And so we have set up a forum where we can share information pertaining to COVID-19. And right now we have more than 50 doctors using that platform. Doctors both locally, and we have doctors in the diaspora who is also helping us with this platform. It's a really lively platform where a lot of technical medical information is being shared. and discussed. And I'm sure that the local doctors would be able to apply many of the things that they have found on that platform when they have patients. So that's an ongoing effort, and we are very pleased with the responses that we're getting. The other thing that we've been looking at, we recognize that in the public health system, there's a shortage of vital personal protection equipment. There's also a shortage of ventilators and other forms of respiratory equipment. And we as a committee, we are working with a number of stakeholders in trying to procure personal protection equipment for the frontline staff in the various hospitals. We are very pleased to report that some of our efforts are bearing fruit, and we expect very shortly to be able to provide to these workers some of these personal protection equipment. We are also, as I said, in the process of looking at sourcing ventilators and other equipment, but that is proving a little bit more challenging. We also recognize that we need to expand our capacity to test for COVID-19. As we all know, the recognized test is using PCR, and there's only one institution in our country that is doing that testing. And there's a lot of bureaucracy that surrounds getting a test for COVID-19. We have since written to the Chief Medical Officer, and we have asked him a number of questions so as to clarify what is the situation with testing. Because the general public is not sure, for example, what criteria is being used for testing. We understand that a lot of COVID-19, when they go to the public institutions, they are being treated and sent away, but they are not being offered the tests. And so one of the things that we would like the Chief Medical Officer to do is to clarify who would be able to access the tests. We also know that in many of the regions, it is very difficult to access testing. And we've asked him to explain to the general public what mechanisms are in place that persons going to various regional hospitals or health centers would be able to access the tests. And there are a number of other questions that we've asked. So we will be releasing that to the general public so that, and hopefully when the Chief Medical Officer answers these questions, we'll also make them available to the public. He himself can release the information publicly so that persons would be well aware of what is happening with testing. On our own behalf, we have been trying to see whether partners overseas would also be able to access PCR testing. And if we are successful in doing that, we will, of course, pass that on to the public health system so that they can expand the amount of tests that they currently have. One of the other things that we are looking at, while there's no treatment per se for COVID-19, various hospitals who have been dealing with patients with COVID-19 have come up with various regimens in terms of treatment. We have been talking to pharmaceutical suppliers locally to understand what stockpiles of these medication that we have in place and to see what can be done to ensure that we have adequate supplies. And so that conversation is ongoing. So in case we have a surge of patients, that we will have enough pharmaceuticals available to respond to these cases or to provide treatment for these persons. We also, based on what is emerging with the science, we know that the advisory that has been put out is to keep your social distance. And that is to stay 6 feet away from each other if you are in the public, and not to have a lot of people congregating at one place. More recently, we have seen one of the studies that have been released by MIT this morning is suggesting that even 6 feet is not going to be enough. And in that particular study, they're saying that as much as 27 feet away, these particles can travel. And so we have to be very cognizant when we are in the public and to maintain that social distance. But more so, it is even better if we isolate ourselves and stay at home. And I think we would like to emphasize that if you don't have any business where you need to be out there in the public, stay at home. This is extremely important. And this is one way in which we can help to prevent the spread of this disease. We also know that apart from droplets, that you have this disease can be transmitted. What is being touted is that by droplets or fomites. What is fomites? This is things like when you touch surfaces, you can get infected by touching those surfaces and putting your hands in your mouth or your nose or near your eyes, and you can get infected. So one of the things that is recommended now is to use masks. And I'm sure Dr. Vinaya Prasad would want to talk more about the campaign that we will be launching shortly pertaining to masks. So within the last few days, we've been very active, and I'm extremely pleased by the response of the medical community as we work together to prevent the spread of COVID-19 in Guyana.
I'll go to Dr. Vinaya Prasad.
Thank you very much. I am sure by now all of Guyana is aware of the crisis situation that we are facing when it comes to COVID-19. It has been considered a pandemic, and in Guyana we have had our own experiences with COVID-19, the coronavirus. And as such, there are a number of measures that would have been released by the World Health Organization and the Center for Disease Control, the CDC. And many persons by now are well aware of those measures, which includes covering your cough, washing your hands for at least 20 seconds, and Dr. Anthony spoke about social distancing. However, to prevent completely exposure to COVID-19, the best and most effective of all these measures is staying at home. Now, staying at home could pose a challenge to many people for various reasons, be it financial or because they are essential service workers. With this in mind, and conscious of the need to protect from exposure, this committee is going to launch a campaign. Much work has been going on, and some of that work has also been shared with you by those before me. Utilization of social media in various ways to connect doctors who will share their experiences from various countries, various hospitals, whether it deals with treatment, intervention, prevention, complications, and protective measures for health workers. And also, as was mentioned, a Facebook page which is called Doctors Online 24 Hours. And this is reaching out to people who are at home. They are frustrated because they may not be able to get through to the hotlines, or they are just limited from getting medical help because the regular clinics that they go to are not working. To alleviate some of your fears, to assure you and to provide useful information, these local and international experts, doctors, will be providing all the advice and guidance you need to keep you safe at home. And it's not only adult medical issues we're dealing with. We're also dealing with children. So pediatricians are also there because children are of great concern in this. the elderly, also a high-risk group, people over 60 years old, and people who have other illnesses, especially heart and lung disease, and immunosuppressant type illnesses like diabetes, the high-risk vulnerable group. So you can inbox these doctors on Facebook all around the clock to get all the necessary information and guidance you need. Now, masking has been emerging as a quiet hero because we've looked at what the world has been doing and all the measures that were spoken of, whether it's social distancing, self-isolation, washing your hands would have been carried out by most of the countries. We have seen some countries have better results than others. If we look in particular at Japan, Taiwan, and recently the Czech Republic, we've seen, compared to the other countries who have higher incidences of the COVID-19 coronaviruses, these countries that I mentioned before have low rates of patients who are dying. And this is an important difference. What are they doing differently? Well, in addition to all the other measures, they are masking. In the case of the Czech Republic, they have recommended and enforced compulsory masking when leaving your home. What's the purpose of that? Masks are different. We have heard of the N95 respirators, they're surgical masks, and now we are proposing self-made masks or DIY, do-it-yourself masks. Why is that important? Masks are physical barriers, and as such, they can provide the necessary protection to you when it comes to other people. But is just wearing a mask what it's all about? The answer is no. You need to not only wear the mask, you need to wear it correctly. And you need to wear it at all times whenever you are around people. So what does the mask do? When you put on the mask, you prevent the droplets from you from getting out there to another person. So in essence, you're protecting that other person from anything you may have. And likewise, if the other person wears a mask, which is why we're saying everyone should wear a mask, by the same token, they are protecting you. So it has to be everyone wearing a mask, and we are pushing for this to be enforced across the country so we protect each other. Now, the droplets from the COVID-19 virus, they're particularly small droplets. Surgical masks are about 95% effective, but if we make our masks with 100% tightly woven cotton, then we can have about 75% of that virus captured. And this is important because I believe it is better to wear a mask and to have protection than to have none at all. So what I would like to recommend to you is that you visit our Doctors 24 Hours online page for guidelines on how to make your mask at home. You can do this with your family. You can get your persons who know to sew on the outside to start producing as many masks and help us to distribute masks freely. Why do I say help us? Because we are currently trying to get together a number of masks to distribute freely to the public. We plan to put these masks at various points where people can easily pick up one. You can use it as a pattern, and you can also use it for yourself. The material is 100% cotton. Now, I'm sure you have pillowcases, bed sheets, 100% cotton t-shirts that you can use to make these masks, because it is virtually impossible for us to make masks for everyone. However, I'd like to appeal to everyone who's looking at this program to support our endeavor to get as many masks as we can, starting with the vulnerable populations and the essential services. So if you would like to donate, you can donate bales of 100% cotton and also help us to buy these masks. Each mask costs $55. You can direct your donations through the Facebook page, Doctors Online, or you can call Freedom House to get information on how you can donate to this cause. Number of people have already started donating, but we need to do this together. COVID-19 is just not one person's business or just a small segment of our population's business. We have to work together. I protect you, you protect me. Everyone in Guyana should mask. Mask up Guyana, save lives, and let us ensure that we limit and contain the spread of COVID-19. So I really want to urge you, wear your masks, make them if you will, take advantage of our masks when we'll put them out, and we will tell you where those distribution points will be in the days ahead so that you can get your mask. Encourage your seamstress friends to make masks, give it out to people around you. The beauty about making your own mask with the cotton fabric, it's comfortable, it's breathable, you can reuse it, and you can wash it. And how do you wash it? You can wash it in soap and water and dry it out in the sun, or you can wash it with 5 tablespoons of bleach in 1 gallon of water. That's the composition of a safe and effective solution. Soak your mask in it for a little bit, dry it out in the sun, and then you iron that mask. It's a good idea to have more than one mask, so while one is out drying, you have another for yourself. So I really would like to urge you, mask up Guyana. We need to do it. This is our way of being part of a wider effort. But more than all of this, I really would like to tell you, stay at home. That's the most effective way of preventing and limiting the spread of COVID-19.
Thank you very much. We would like to ask Hugh Todd, who heads the Social and Economic and Financial Subcommittee of the Forum, to give a report on what we've been doing there.
Well, thank you very much, Gail, and good day to you, Guyana, and I hope you're staying safe during this difficult period that we're going through. I would like to iterate the fact that while we at the subcommittee have been doing much work to look at social and financial and economic relief measures, we want to let the Guyana public understand and be aware of the fact that our first line of defense is a behavioral change. So economic and social subcommittee within the broader ambit of the task force that we've put together on March 28th. We've met on 3 or 4 occasions, and we have put together some measures that we believe that can create an impact in helping to keep our economy afloat. And while we recommend these measures, we want to let the Guyanese public know that it to take a behavioral change as a first line of defense to combating this pandemic. So staying at home, self-isolation, and using your masks are all very vital to helping to prevent the spread of this disease. As you all know, the economy has been in a slump for some time now. So economically, we have been weakened, and that would affect our capabilities in terms of financial relief measures. We believe that it is necessary for us to take a very proactive approach to bring to the people of Guyana measures that we believe would help to stimulate some amount of economic drive and activity and to keep our people taken care of while we try to combat this from the medical end. So the subcommittee consists of the People's Progressive Party Civic, Change Guyana, United Republic Party, the Private Sector Commission, as well as the American Chamber of Commerce Guyana. And we expect other stakeholders to join us because this is just a work in progress and it's actually a working document that we put together. So far, when we look at the economic relief measures, we want to focus heavily on deferring loan payments for up to 6 months, effective 1st of April. We believe that an automatic increase in overdraft limits, for businesses to address working capital during the downturn within the business activities. We believe that that is something that we should work on. We're looking at subsidies for wages for distressed businesses, and this is all trying to keep the small and medium-sized businesses afloat. And these are just some of the measures that I'm going to give you because even though the list is not exhaustive, I don't want to take up too much time. In terms of our social support, we want to advocate that NIS contributions be deferred, health and private hospitals across the country to provide assistance with COVID-19 cases, public assistance to old age pensioners for the next 3 months, and this is at minimum. As you all may be aware by now that we've had some issues today with our pensioners receiving their packages. We believe that the authorities would need to have better measures in place to accommodate our pensioners so that they can be able to uplift their pensions without any undue hardship or harassment or any stress. So that is something that we will be paying keen attention to. On the education side, we want to reduce cost of data for students preparing for the common entrance examination, and that also includes our teachers. For tertiary level students at the University of Ghana, that is, we want to have a financial relief package for all students for semester 2 because we want to cater to them because we know that they would have already exhausted some of their hard-earned money, so we want to be able to provide some amount of relief for them during this downtime. On the financial tax relief insurance cover measures, we believe that it would be fair for zero-rated tax on all items that would deal with any sanitization, cleansing, and helping to bring relief in terms of buffering the spread of this disease. So things like soap, disinfectant sprays, hand sanitizers, sanitizing wipes, face masks, rubbing alcohol. We don't believe that these items should attract any taxes. That should also extend to pharmaceutical or some pharmaceutical medications that people will need to take during this time. We would like to advocate also the waiver of all taxes on data effective immediately, as well as on electricity and water. And I think this would help to bring some amount of relief for population, most of whom might be already constrained by having to expend a lot of money in combating this disease at the household level. We want to also work with insurance companies to extend coverages of up to 6 months so that you can have more money you have in your pockets at this point in time, at least in the short and medium term. We believe it will help our citizens in trying to find the right ways in keeping themselves safe. So the attention now should be just centered squarely on trying to combat the disease. And I think that is some of the measures that would help to stimulate the drive in that direction. When we look at employees and citizens' welfare, we look at a temporary move for the requirement to pay income and corporation tax upfront. And this should help, as I mentioned earlier, to keep more monies in your pocket to help deal with this disease. We talk about extending the pay of utility bills and hire purchase debts, especially for those persons who may have purchases that they have made with some of the retail companies. We believe that negotiations can be undertaken so that those bills can be postponed temporarily so that persons may have more money, because as we all know, some persons may be laid off. So the less expense you have during this period, the more money you'll have to keep your families afloat during this period. Under the small and medium-sized businesses, we want to recommend rescheduling loans and mortgages, relaxing overdraft facilities, and in some other measures, we also would like to allow for labs to bring in kits, those are test kits, and PCR machines without taxes. So everything that I have said speaks to an inclusive approach from all of the stakeholders that I've mentioned earlier, putting measures out there that would help to keep the economy afloat. Mind you, we don't have a budgetary allocations as yet. It's still a live document, so we'll be working on it continuously, and as more ideas before, we're going to keep updating the document and have a document that would be tailored for general circulation within the next few days. So thank you for listening to me. But I want to show you that these measures would not cure the disease. These are financial and economic measures that would help to keep the economy afloat and keep people alive and going, and not to allow too much frustration and anxiety to hit people, because most people would be a bit fearful of how they will survive. So these measures would include all of the authorities involved so that we can have a broad-based approach to this. But I must stress that the first line of defense for this pandemic is a behavioral change, and we need to wear our masks, we need to stay at home, and we need to have self-isolation. This is the first line of defense. I thank you.
Thank you, Dr. Anthony, Dr. Prasad, and Mr. Todd. Very clearly, we, as a national COVID forum, we are dealing with and not contradicting what are the basic messages that the National Task Force has put out in relation to social distancing. However, we're insisting on social distancing of 6 feet. In many cases, people are not adhering to that. And there are also sometimes different signals coming from different government entities on what is the distance, 3 feet, 4 feet, 6 feet. We're saying 6 feet as minimum. Frequent hand washing and sanitizing surfaces. But we're adding to that and advocating what happened? Todd finished, so I went in. So what did I do? So you'll cut and splice? Huh? I can't hear you.
Yeah, we'll cut and splice, no worries.
What happened? You fell asleep?
No, I was talking with them muted. So go right ahead.
We recognize as a national COVID-19 forum that messages are important, and messages coming out of the national level are important for our people. At this point, there are messages that are not clear. And therefore, we believe very firmly as a forum and as advocated and represented by the speakers before me, that people have to stay home. Self-isolation is critical, particularly in this stage where we're now starting to have cases, that we try to reduce the pool of people who are accessible out there and vulnerable. And therefore, the policies need to change, and we are not in government. What we're advocating and calling for is a self-isolation, stay-at-home policy. This means that only essential services will continue, and that all individuals, when they leave home, that they leave home with a mask on, as Dr. Prasad spoke about, but that they go out of their homes infrequently, whether it is to go to the ATM to get money, or to the bank, and or to go to the supermarket or the market to buy food, or to the drugstore to buy necessary pharmaceuticals. We believe that the government has to have a clear-cut policy. We believe that a self-isolation, stay-at-home, with only the essential services and persons involved in essential services being out there and all wearing masks, all, is critical. And therefore, the government has to not be equivocal in relation to what are the places it's closing. All bars, rum shops, restaurants, excluding maybe takeout service, which in many countries that has continued, and the retail sector should be closed. All non-essential staff in the public sector should be allowed to stay home with pay. We are advocating that ATMs, pharmacies, supermarkets, bakeries, and markets should continue to function. However, that in all of these, again, mask and sanitization must be practiced, and that those in the markets are also wearing gloves. So, and those who are making foodstuffs, that they're properly attired and wearing gloves and mask as well. Thank my colleagues, Dr. Anthony, Dr. Prasad, and Mr. Utad for their contributions to the National COVID-19 Response Forum, and also to thank them for their presentations today to the public. We are confronted in Guyana with conflicting messages coming from the task force and from different agencies in the government. And therefore, it's important for us to have one position on the various issues so that people will not be confused and people will not be getting conflicting messages. There are in some parts of the country curfews. We do not understand the virtue of a curfew from 7 o'clock to 6 in the morning, as coronavirus is not a vampire. It doesn't only come out at night. We are advocating instead for a national policy of stay-at-home self-isolation. This in particular would relate to persons who are involved in non-essential services, both in the public and the private sector. This means that only essential services will continue, and individuals would leave home infrequently to purchase food, pharmaceuticals, or to obtain money from the ATMs or the banks. Therefore, we're making a call on the government to stop vacillating and to close all bars, rum shops, restaurants, except those that offer takeout services, that the takeout windows would be allowed to continue, and the retail sector. All these should be closed, and all non-essential staff in the public sector be allowed to stay home with pay. We're advocating that ATMs, pharmacies, supermarkets, bakeries, and markets should continue to function. However, the numbers of staff working in those areas can be reduced to prevent any and to keep within the social distancing of 6 feet apart. It is essential that all persons working in these areas must have masks on. All staff in the public or private sector who are considered essential and who have continued to work must wear face masks at all times, including policemen and women, prisoners and prison staff, those in the homes for the elderly and those working in the homes for the elderly, post office workers, minibus drivers, boatmen, sailors, market vendors, taxis. And we recognize in our country that there's a significant section of the informal market that exists, and that this is a group that is very vulnerable. They need to work because they basically live on a day-to-day basis based on their earnings that they make. And we recognize too that a significant proportion of this informal sector in Guyana is managed by women, and more particularly, the majority are single parents. We recognize that these have no choice but to work, and therefore we're calling on them to wear face masks. We are not calling for a partial or a shutdown of the country. We're calling for a stay-at-home self-isolation as a first phase in our campaign to reduce the transmission of coronavirus, COVID-19, in our country. We also believe that the issue of, we want to make it clear in relation to the Everyone Wear a Mask campaign, is that one of the reasons this has also arisen in many countries is because of the shortage of personal protection equipment, including masks, gloves, gowns, etc., for health workers in the sector, in both the public and private sector across the world. And therefore, we believe that if we called for masks to be worn without offering an alternative, those being made at home, being made, manufactured, or even imported, that those are the ones that the general population would use, reserving very, very limited resources and depleting resources as we speak for the health workers across Guyana. And so that is why Dr. Anthony's position of trying to acquire more PPEs for the health workers. None of what we're proposing in any way conflicts with the measures that have already put in place, that social distancing of 6 feet, no handshakes, no hugs, frequent washing of hands, and sanitizing of surfaces, both within your home and outside. There are a number of handbills or information we wish to share, and we will be putting that on the Doctors Online Facebook, as said by Dr. Vindi. And we will also be creating a variety of messaging to help people with either to make a Facebook, how to clean it, a face mask and how to clean it, and or what measures they should take to protect themselves when they enter their house or when they leave their houses. So that, and also as Dr. Frank said, being clearer on what are the symptoms or the signs that allow you to know that you should get medical care. We hope that the government and the National Task Force will come on board with these two campaigns, because we believe firmly these are critical to saving our people, reducing the risk of transmission, and saving lives, particularly in an environment where we are ill-prepared to handle the pandemic, as we are seeing explode in other parts of the world. We're concerned that there are piecemeal responses. Some of them are reactive to what is happening. And so we've seen the Ministry of Public Infrastructure put out a number of instructions to do with transportation, including extraordinarily heavy penalties if persons do not obey. The suspension of ferries in critical areas, and even suspension of flights to border communities in Guyana. These are reactive and are certainly not productive and will not give the kind of protection that is required for our people. Ironically, whilst putting out very draconian measures and difficult measures for public transportation, both land, air, maritime, for example, and road, that they still allow on the various speedboats to have their normal load of persons without in any way requiring masks, etc. So there are contradictory messages that the government is sending that we need to be able to rectify these issues so that there's clarity. There is clarity on what we need to do. One, self-isolate, stay at home. We're in a virtual world, and so this meeting has been done in a virtual setting. We are not meeting together. The stakeholders will be setting up their virtual platform so we can communicate, and therefore technology is an important tool to allow for us to communicate and to be on top of what's going on. However, we have to recognize that there are many parts of Guyana that have no access to Wi-Fi, or if they do have access, they have to pay for it. And therefore, these are the measures social and economic measures that Hugh Todd spoke about. However, again, in interior areas, there are supposedly government of Guyana Wi-Fi settings. However, most of them are not functioning. And there are others that are private that charge people as much as $1,500 to put data on their phone so they can be able to communicate. These are areas that are extraordinarily vulnerable in health settings and health facilities that are totally unprepared. So we have to recognize that while we're doing all these issues, we have to be able to try to reach more and more people. And that is why we will be in communication with the two Shaos in different parts of the country to get them involved in this campaign to stay at home and to wear masks, and to assist them and guide them in making face masks in those communities. So that these are the issues we have dealt with in the last few days since we were started, and we were launched by by presidential candidate Irfan Ali, and that we will continue to meet with you on a daily basis if necessary, and update you on what we're doing and what we're advocating for. We hope that the government will not be reactive to what we're saying and to go on the offensive. The proposals that Dr. Prasad spoke about, the face mask, We are not in government. But however, the government has resources that it could mobilize to be able to add to, in a larger way, our efforts in terms of providing face masks for the general public. And we hope they will see it in that manner and not to become reactive to what we're doing. We ask you as the public to think about what we're saying and to stay at home, take care of your family, and to make and sew your mask if you can, and go out with it, and to take all precautions when you go out. For those on public transportation and in any form of public transportation, please wear a mask when you go on before you go on the minibus or the taxis or larger buses or the ferries. Please sanitize your hands. And when you come off, do the same thing. And there are guidelines we will be issuing that what you must do when you get home with your clothing, etc., to make sure that you're not transmitting also within your home when you come off from the streets. So thank you for listening to us, and we will be giving you updates. We will be submitting press releases and also using the electronic media to get our message over. Thank you very much for listening to us.